Good morning, everyone. I might have been on mute right now.
Hold on.
I wanted to welcome everybody. It's great to be here with you all. We're getting some last little pieces put together here and waiting for a few others to join us. So we will kick this off in just the next few minutes. Okay, we'll be right back with you all.
Hey, folks, can y'all hear me?
Yes, Mr. Secretary.
Okay, good. Hey, Paula, we're all good.
Okay, they can hear you now?
Yep. Bye.
We can't see you.
I don't know what to do. Yeah, let me start my camera here in a second. Just, I wish I had some Chicano art to impress Gastulo with.
We all do.
I enjoyed the town hall meeting of yesterday with the Brown Institute secretary. You did a fabulous job. What an interesting interview. I like
the hour flies by, you know.
Yeah, so you did a very good job. Thank you.
Because the personal collection is limited, I do have some awards I've received in reviews that have some nice art. So that's what we're using behind me here.
Very good, everybody. Thank you all for joining us. We are live on Facebook as well as WebEx. Thank you guys all so much for joining us today around our My Vote, My Health virtual town hall. We're tremendously excited to be here with you all. A couple little notes for everyone. If you are joining us on Facebook Live, please use the comment box to submit any questions that you have. Our team will help to our panelists and ensure that they are spoken to. Do note though, if we can't get to every one of your questions, we will definitely follow up with some answers to those questions. We will have a Q&A session at the very end, but feel free to submit your questions at any time. Same goes for WebEx. There is a chat function at the very bottom of your screen or the options. Please do use that chat box to submit any questions, as we mentioned. And also note that we are going to be sending out a few questions to you as well. So you'll see some of those coming up through the poll options here as well. So we'd love to hear from you, but we are just tremendously excited to be having this conversation with you all today. And with that, I want to give a warm introduction to our Assistant Vice President of Civic Engagement, Jenny Carrion, who will be helping to moderate this conversation and will be kicking us off. All right, so let's give a round of applause, a digital virtual round of applause to Ms. Jenny Carrion.
Thank you, Milan. Appreciate all your work and all your team's work to get us here today. As we all know, our nation is at a juncture, a true tipping point, and only together can we challenge the systematic infrastructure that our community has been advocating towards for far too many generations. Because one thing that our history has taught us is that only when we work collectively can we really achieve collective action. I've been doing this work for about 20 years, and I love all things having to do with civic engagement. I value that my mother's vote has as much weight as someone else's parents' vote that didn't have my mother's historical challenges. So I'm thrilled to be sharing this virtual stage with some ordinary humans that have accomplished extraordinary things. From a young man from Pacoima who was a baseball star in high school and went on to MIT and is now our Secretary of State, to a strong woman who got hooked on community organizing in Minneapolis and is now the Vice President of Government Affairs at the California Community Primary Care Association, to a man who was born in Puerto Rico of Peruvian descent and grew up in Kansas, that's brand new information for me, and is now a political science expert and co-founder of Latino Decisions, the gold standard in Latino American polling, to a man born in the Sierras of Chihuahua, grew up in East Los Angeles, and is now the president and CEO of the largest community health center in the country. It's my pleasure to welcome you all and now introduce an enduring trailblazer in community health, Mr. Castro de la Rocha.
Good afternoon, everyone. It's indeed a pleasure to be here and to welcome the panelists and to welcome all of you. I have a long history in community health centers and in community engagement and empowerment, as we referred to it back then when I became an activist in the late 60s, early 70s as part of the civil rights movement. You know, that flame, that passion to help uplift our community in every area that I could be involved has not left me. So it is indeed a great pleasure to be here. Those of you coming from other community health centers may already know that their foundation lies not just in medical care, but in rallying the community around its own health by supporting local engagement and addressing the social determinants that impact the long-term physical and economic health. Most of the social determinants affecting our community are absolutely impacted by the way we vote. There's no question about that. Our access to public transportation, affordable housing, the cleanliness of our air, access to nutrition assistance, and public school funding. This is one of the most critical elections of our lifetime. We are caught in a pandemic that has been poorly managed at the national level. And in some states, we continue to have, including California, major flare-ups. We comfortably have the highest number of cases of COVID-19 in the world. And we are in an economic crisis because we cannot get our rounds around this crisis. The U.S. Bureau of Labor Statistics reported that U.S. unemployment reached more than 11% in June and nearly 15% in California. And you know the numbers in our own communities. We are at a critical point for cutting emissions and reversing climate change. College is unattainably expensive or way out of reach for many in California, and those who further their education are often going to have to be spent most of their life paying their debts. Our budgets for military and law enforcement vastly exceeds the budgets that permit for areas that would bring our country up and fulfill our human needs. In 2020, we are still talking about racism and civil rights, and we relied on our governors, our mayors, and our collective outcry of regular people to get federal agents out of our cities and away from those exercising their basic right to protest. We need everyone in our community to not only vote, but to know the dates leading to the elections, the deadline for voter registration, and for vote by mail ballot requests. We are lucky to live in a state that is proactively enabling mail-in ballots this year. Thank you, Secretary Padilla. Particularly, and I would say this, particularly as we see polling places shutting down or requiring excuses beyond COVID-19 to vote by mail in other states, beyond me. AltaMed has made possible because a group of activists way back in the 60s in the East Los Angeles decided to get active in the community. But some of those activists protested against and advocated, and what they protested against and advocated, we still haven't realized that today. Now, this is 50 years later. And so in 2020, AltaMed holds citizenship information sessions. Information informs our community about their rights under policies like the Public Charge Rule and DACA, and promotes participation in the census and elections. As healthcare workers and as human beings, it is absolutely our business to encourage our communities to vote. President Obama spoke at John Lewis's funeral last week, and he said, "This country is a constant work of progress." And I got to tell you, he's absolutely right. But it is us to do, it leaves it for us to do the work so that we can make that progress possible. Thank you very much.
Castelo. The pandemic changed how we vote this fall, with voter education more essential than ever to ensure voters understand their options. To speak to us about our new normal, we're joined by Secretary of State, Mr. Alex Padilla.
Well, thank you, Jenny, and a big thank you to you, AltaMed, team for convening this important and very, very timely town hall. And I also want to take a moment to recognize not just AltaMed, but the California Primary Care Association, and salute to all the healthcare workers, all the frontline workers that have been working so bravely, courageously, and fearlessly to respond to the COVID-19 impact in our communities. We know that the association and AltaMed in particular are tremendous leaders in terms of providing healthcare and access, but you're clearly blazing trails as leaders in civic engagement as well, investing in civic engagement for the purpose of improving quality healthcare and healthcare access for all in the long term. And it's this, the AltaMed efforts themselves have become a model program for the rest of the state to follow and the rest of the nation to follow. You made your mark already in registering the thousands of voters prior to the March 3rd primary this year alone. And so we know that there's more work ahead. But as we convene here today, get this, we are 90 days, November 3rd. And I'm going to stop calling November 3rd Election Day. The way to start thinking about it is November 3rd is the last day to vote, right? Because you're not going to have to wait until November 3rd to cast your ballot in California. It'll be the last day to vote if you haven't voted earlier. For starters, let's subtract 29 days from that 90-day time frame. In 61 days, you should check your mailbox because your ballot will be arriving around that time. So what's going to be different about this November? Every election, we work hard to make sure every election is as accessible as possible to all eligible citizens and as secure as possible, of course. But in the age of COVID, we have to work hard to make sure that the voting experience and opportunities are also healthy and safe for voters and election workers alike. So we begin by letting everybody know that every registered voter in California will be receiving their ballot in the mail in advance of the election. Like I said, in about 61 days, start checking your mailbox because if you're registered to vote, your ballot is coming to you automatically. In California, you don't have to go through the extra step of requesting it. We're not going to ask for an excuse or a note from your doctor. We believe you deserve to have the peace of mind, safety and comfort of your home first and foremost. And so there's going to be a lot of voter education around both the vote by mail options as well as the in-person options, which I'll speak about in a minute. And so we recently launched a Vote Safe California initiative to help educate voters statewide on what they need to know. The voter registration reminders, for example, that you mentioned, along with the voting options. So first and foremost, vote by mail. But we know California is a large and diverse state with a large and diverse electorate. And there's a lot of people who will need to vote in person, whether it's because there's an accessibility concern, maybe they need language assistance, a replacement ballot to participate in same-day registration, or whatever the reason is. We want to make sure we protect people's voting rights as well as their public health. So we're working hard to ensure as many in-person opportunities to vote as well safely, and not just on election day, in advance of the election. So in most places, you will have at least 4 days of voting, not just Tuesday, November 3rd. And for the folks who choose the in-person option, know that voting experience is going to be a little different. Working hard to procure all the PPE that we're going to need. And we will be implementing all the physical distancing and other public health requirements at that time to keep that in-person experience safe for voters and election workers alike. But at the end of the day, the strategy is this. The more people we can encourage to vote early, whether it is by mail or safely in person, will mean shorter lines, smaller crowds, and a safer experience for the folks who waited for the last day to vote, Tuesday, November 3rd. And lastly, I want to rattle off a couple of specific recommendations for voters to prepare, right? Elections workers at the state and at the local level are getting ready, but there are some things that voters can do to make sure they're ready too, and that we build a smooth experience this November in California. First, verify your voter registration status. Most people I talk to say, I've already registered, but if you haven't voted in a while, or maybe you've moved and you haven't updated your registration record, we want to make sure that we have the current address before we start mailing ballots out. So you can go to voterstatus.sos.ca.gov and verify your registration information. If you need to update your record or to register for the first time, you can do that easily at registertovote.ca.gov. And finally, I'm going to encourage people to sign up to our ballot tracking tool. We call it Where's My Ballot? It's a very fancy title. Where's My Ballot? You can sign up to get email messages, text messages, or automated call notifications on the status of your ballot as it's working its way through the Postal Service on its way to you, on its way back to the county. And Castro, imagine getting a notification that your ballot was received and counted. Great for transparency, great for accountability, great for public confidence in vote by mail and in our elections, because there's people out there trying to undermine our confidence in the elections, and we're not going to let it happen. And finally, two more requests. One, as you can imagine, that elections preparation is different during COVID-19, not just for the interest of the voter, but also elections administrators. And a lot of the senior citizens and retirees that have so graciously volunteered in past elections to help administer voting at the polls are not going to be available this November for obvious reasons. They're the most vulnerable to the coronavirus. And so we're going to ask all of you participating here today through your networks, please help get the word out. If there's folks that are healthy and are willing to volunteer to administer the election this November, the county needs your help. So let us know, and we'll be happy to connect you with county elections officials in Los Angeles and Orange County and anywhere throughout the state. And last but not least, not elections related, but breaking news that the White House is cutting short the time period for census field outreach activity, and even the deadline for us to respond. What was the end of October is now the end of September. I don't put anything past this administration. They may cut the deadline even sooner. So for folks who have not participated in the census yet, don't wait. Do it today. Spread the word to every family member, every friend, every neighbor, every coworker, because you need to make sure that everybody's counted in the census. And thank you again for this opportunity, Castillo and AltaMed. We look forward to the discussion.
Thank you, Mr. Secretary. We'll definitely start implementing some of your recommendations for our work coming in November. Now, as the global pandemic intensifies, along with civil unrest, an already fractured healthcare system is unraveling before our eyes. Hospitals, ICUs are filling up, community health centers are in jeopardy of shutting down, and access to COVID-19 testing remains strained. Politicizing our current public health crisis has laid bare how civic engagement and better healthcare are fundamentally intertwined. Healthcare access remains the #1 issue on voters' minds. Some on this, and how can we work collectively together as a state and our healthcare organizations, is Andy Martinez-Patterson, VP of Government Affairs for CPCA. Andy?
Thank you, Jenny, and thank you, Costello, for having me. And thank you so much, Secretary Padilla. I have lived in many other states, including Mexico, and I cannot tell you how easy it is to live in California and to participate, and it's not that easy everywhere else. And in particular, vote by mail is so important because the easiest part of voting should be getting and putting in your vote. The hardest part is all the ballots in California. I have to tell you, it's coming from out of state, it is craziness on the ballots. And you have to do a lot of reading and talking to people to know how to vote. So we are very lucky to live in California. I feel very fortunate to live here. I've been here for the last 12 years. I came, as Jenny referenced, from Minnesota, and I got hooked on community organizing and civic engagement, working with a Somali community and connecting them there to the broader work of the University of Minnesota and how important that was. And when I applied actually to CPCA, I had no idea about healthcare. I had no idea about community health centers. but I saw that they were part of the civil rights movement, and I said, sign me up. I want to be part of this. And we've been working really hard at the California Primary Care Association on healthcare access. And that is tremendously important. And I want you, the health centers out there, and for anyone who doesn't know about health centers, to just know what an amazing asset they are to the United States and in California in particular. There are over 1,400 sites, plus more that we don't count that are considered intermittent or they're only open part-time. And they serve over 7 million Californians. That's 1 in 6 Californians are being cared for at a community health center in a model that is resoundingly successful. That's why there are so many of them today. And they were part of the civil rights movement. They came from the idea that we need health is more than just access to a doctor. It's also good food and safety and clean air and all the things that go there. But healthcare access, just the medical care, has been a massive struggle to get to all the people that need it and to get it where they need it and when they need it. And in California, we've done a great job. And one of the things that we're realizing so clearly now is that the impediment to excellent health are the social determinants of health, so many of which are impacted by who you vote for and who comes in and who's fighting for you and who knows what's happening. So that is why now is so important. It's always been very important, but healthcare access was the main focus. But now, because AltaMed has really shown us as a trailblazer and showing us how to do this and leveraging the trust and the knowledge of their communities, is connecting and showing us. The trade association is here to support our members and to spread the word. We're not necessarily the ones to tell you we know how. The health centers know how. And we're here as a partner to learn and to then spread it and help everyone do it. So I just want to acknowledge a few pieces of research. One, there's a correlation between a lack of voting and higher health disparities. And in healthier communities, wealthier communities, there's a much higher propensity of voting. We need to flip that. The people that need the voice in government the most are the people who are being most negatively impacted by government's decisions, and they need to turn that dynamic around. A more representative government will increase health equity for all people, but for people who have been disadvantaged, they often don't trust government for very, very good reasons. So who can help change that? Are the stewards of trust, which are community health centers. Who do you share more almost with than you might even your own family members? It's your pediatrician, your OBGYN, your family doctor. That's who you trust with your body and your heart and your soul. That person can also help show you where and how to empower yourself through your voice. I liked one of these quotes that, if you don't mind, I read, by Dr. Nicholas Yagoda from the University of Austin. His research has found that nonprofit and private healthcare organizations, particularly community health centers, can help marginalized voters, voting eligible individuals, overcome barriers at the ballot. There is a clear linkage between health and voting, and that's why Cpca is here to be a partner with all the esteemed colleagues on this panel, and we're so excited to be here. Thank you so much.
Thank you so much, Andy. As our communities continue to be disproportionately impacted, at AltaMed, we know that this pandemic is only going to make this being civically engaged more difficult. So what we have done over the past couple of years is we created a very assertive 5-touch get out the vote model. With the generous support from the California Endowment, we launched this campaign in March, and we contacted over 500,000 low propensity voters during the primary March election. That's really has been unheard of and work and seen any other organization do. We were proud to partner with San Isidro Health near the San Diego border and Clínica de la Raza in Oakland. We wanted to prove that this model can be replicated in other health centers and regions across the state. Our external model, if we can put the slide on, Juan, consisted of 5 steps. It consisted of us calling low propensity voters, asking them about what issues were important to them. We then visited them at home and we talked about the mechanics of voting. We showed up with our AltaMed hats and our AltaMed shirts, and everyone was so welcoming. They'd be like, "Are you coming from my doctor's office?" And we'd be like, "Yes, your doctor wanted to say hello, but more importantly, wanted to remind you about the importance of voting to protecting your healthcare." We then sent out text messages and provided voter guides to early voting locations. We called them back and reconfirmed their commitment to vote. And lastly, we coordinated transportation and took many people to vote for the first time, which was always our staff's favorite thing to do. Our internal model consisted of work inside the clinic. We had screensavers at all of our waiting rooms. We had all of our LVN nurses, when they were taking their vital signs, there was posters there in the nursing stations. Our doctors were wearing My Vote, My Health pins in their lab jackets. Promotoras were stationed at kiosks, registering people to vote and talking to folks about the mechanics of this work. We did all of this because we know that the narrative that Latinos are not interested in voting is wrong. The reality is that no one has taken the time to teach our community how this work is done and how to actually vote. And by doing this work, we're actually expanding the electorate. We're lucky to partner with Dr. Matt Barreto, professor at UCLA, and it's my pleasure to introduce him as he presents his evaluation of our campaign. Take it away.
All right, thank you, Jenny. Thank you to all of the AltaMed team, Jenny, Eduardo, and your whole team. It was a real pleasure to work with you. I also want to thank Costello for his leadership and investment in this. It's not hard. It's not easy to run so many wonderful community health centers, but then to add a civic engagement component really takes it to the next level, and that's extremely important. And finally, before I get started, if I could just also recognize the Secretary of State. I think I've seen him on 100 webinars. He's got to be the most active Secretary of State going around and promoting voting, and it's wonderful that we have you leading us and encouraging all Californians to get out and vote. So we're all lucky to be here today with this great company. I'm going to just share my slides now of a presentation that I made. I think you all can see that now.
Yes.
And just walk you through a little bit of an analysis. As Jenny mentioned, we partnered here at UCLA. I am the faculty director of the Latino Politics and Policy Initiative. I'm a professor of political science and Chicano studies over here at UCLA, and I study Latino voting patterns. I partnered on this with one of my PhD students, Angie Gutierrez, who also is writing her dissertation right now about the factors that encourage or discourage Latinos to vote. So we had a great team here. And as Jenny just went through, AltaMed has a really fascinating 5-touch model that they take through in different approaches. And we evaluated that at every step of the way. And we wanted to determine what exact impact did the AltaMed 5-step, 5-touch outreach program have on low propensity Latino voters. What you can see is they start by targeting low propensity voters. These are people who don't normally get out to vote. One of the things to keep in mind is that a lot of campaigns out there and other studies you may have seen, they target all voters, and sometimes they get people to vote who are already going to vote. And so we need to keep in mind what they're doing is really a difficult lift. They're targeting those low propensity voters. They talk about the issues. They canvass low propensity homes. They then send their mail voting reminders. They have text messages, and then they finally follow up with calls and remind them about all of the important and relevant voting details. So it is a really inclusive model that engages with voters. It doesn't just feel like a one-time robocall that you're getting. They're really engaging, and that's why we think it was a successful program. What I'm going to do is walk through and show you a couple of sets of results. I'm going to try not to show you too much data and really just talk about the successes of the program. But I want to point out something very important at the start. We followed a very strict social scientific experimental approach that is now very common in political science. You've probably also seen this or heard of this in medical studies. We didn't just want to evaluate the people who were a part of their Get Out the Vote program. We wanted to have what's called a blind control, people who had no exposure to AltaMed. But we wanted to take this a step further and also to have what is called a placebo group. You often hear of this in medical studies of the old sugar pill. The doctors gave you either the medicine or the sugar pill. You didn't really know, but part of the treatment of the human body is the psychological process. And so they wanted to rule that out by giving you a placebo. We did the same thing here. And so we have both a blind control group that received no information about voting at all, but we also have a placebo group that was given some information, but they were given information and discussions just about their health. So we were having those discussions, and it allows us to have then a very strict comparison, really following the most rigorous standards in field experiment evaluations. And this is what is considered the gold standard in research methodology today. We wanted to bring that to bear when we evaluated the AltaMed program. So without further ado, let me go in and show you some of what we found. This is the overall successful contacts across all the different types of outreach that AltaMed did. What you immediately can find if you just focus in on the percentages in the bottom table is that the control group had a 34.5% turnout rate. The placebo group had a 37.8%, and the treatment group had a 44.9%. This is an increase of 7 points over the placebo group. And this is what is considered the gold standard in research. And 10 points over the control group. So this is a really high amount of increase. In other studies that I have validated or have read in published journals across the social sciences, if you get something around a 3 to 5 point increase, it's really excellent. Sometimes you only get a 2 to 4 point increase. So to get increases over a control and a placebo group of 7 to 10 points is exceptional, especially when focusing on low propensity voters. Then we broke out the results. We wanted to look at two different groups. First, I'm going to show you what happened with just the phone bank results. You can see here in your chart to the right, table 10, there was somewhere between an 8 and 12 percentage point increase. The phone banking results were exceptionally effective, and that's good news because come November, that's going to be one of the more important tools as we may not be able to have full door-to-door canvases anymore. The control group had a 34% turnout, the placebo a 38, and the treatment group 46.5, 12 points higher than the blind control and 8 points higher than the placebo. These are really, really strong effects. Next, we can look at the neighborhood canvassing results. Here we also see impressive increases if you focus in on table 14 on the right side of your screen, where we had anywhere between a 6 and 10 point increase in voter turnout. Again, it's important to remember that voters are randomly assigned to these groups. We didn't focus in on some places where we thought we could do better. There was a randomization process at the beginning, and voters were randomized into either the control group, the placebo group, or being a part of the AltaMed treatment group. You can see from the table at the top, we spent most of our energy in the treatment, but we did set aside a small placebo group so we could have that comparability. Finally, I want to break out your results by different regions across California because, as Jenny mentioned, this was a very robust campaign. It was not only in the Cella region of Los Angeles County, but there was outreach in Oakland, there was outreach in Santa Ana and Anaheim and Orange County, and also down south in San Isidro. What you'll see here is that for each of the different regions, I've broken out what was the voter turnout of the treatment group for both the phone banking and the canvassing. Across all regions that we analyzed, we found widespread effects. It wasn't just the case that this only worked in the Cella region where AltaMed pioneered this. We found that this was effective across the state. In fact, one of the largest effects that we found was a 15 point or 14 point, increase over the placebo group in San Isidro in the phone banking, from 31 to 45% voter turnout. Again, those voters are randomly assigned, and we see a 14 point increase. Similarly, we saw a very large increase in canvass in the Santa Ana and Anaheim group, where we saw a 13 point increase over the control and a 7 point increase over the placebo. This was widely effective across the state. What that tells us is that we can generalize these results. This wasn't just the effect of one specific community site or the other. This was widespread and pretty consistent from site to site. We also looked at what happened if you received multiple types of contact, because this program was in the field for multiple weeks. They really do a sustained effort of reaching out to these voters. And one of the things that you can see here is that if voters successfully received 3 or more types of contact, their voter turnout shot up to 52.3% over the control group of a starting point of voters who received nothing of 34%. So you have the ability to really move people. That's an 18 point increase for the people who got the most amount of contact across the treatment groups when you take all of those groups into account. The final thing that I want to share with you is a thought experiment to say, what if AltaMed had funding to expand their program to all Latinos across the entire state? They already ran a very large program, and I think Jenny right now is thinking, don't kill me by making me try to canvass every single Latino voter in the entire state of California. But let's just imagine if those same rates that we just saw, those same rates would hold. That would be a gain of 16,000 voters in Alameda County up north. In Los Angeles County, if they had run their program on every Latino voter countywide, it would have resulted in an extra 243,000 Latino turnout. In Orange County, we would have estimated 37,000 extra Latino votes, and in San Diego, 55,000. All told across the entire state, 655,000 additional Latinos would have been motivated to vote by getting those 7 to 10 to 14 point increases by the successive contacts. And so it's a program that is proven to be effective. As I said, we used the most rigorous social science standards. We wanted to make sure we had a control and a placebo group. And it was one that can be replicated, as they have now shown with many of their partners. That concludes the presentation. I'll be happy to take any questions, and I'm otherwise going to end my screen sharing and turn it back over to you, Jenny. Thank you.
Thank you, Matt. It's very exciting to see these results, and you validate what we've known, that when we target our community members and have trusted messengers, our community does show up. So now it's time for us to have a conversation as a panel. Wanted to hear some of your input from what you've heard from Matt's presentation and just get anyone, either Secretary
and everybody.
No, just one quick comment. I put in the chat feature. People were asking, can you repeat those links again? Can you repeat those web addresses? We're making it easy for everybody this go around. All the online tools and resources for the election and for voting are at vote.ca.gov. Vote.ca.gov. So you can go there, find the registration, cybersecurity information, verify your registration status, the Where's My Ballot tool that I mentioned. You need to know in one place.
Can I just wanted to make a very quick comment. Matt, we actually did try to get funding to do a voter registration effort statewide. We were not able to get the funding for it. Perhaps in the future, we may be able to find those kind of resources. The second thing that I wanted to comment, for those of you that are in other community health centers and are joining joining us this afternoon, do not underestimate the power of your community health center, the history of your community health center, and the relationship that you have as a trusted institution with your community. This only demonstrates what we're capable of doing. And Alex, I'm going to borrow something from you yesterday. The hope is that we don't finish on election day, that we continue to be actively involved and engaged. We have been actively involved in community health centers, some of us 40, 50 years. There are community health centers that have been around 50 years servicing low-income communities. Let's use that trusting relationship. Continue to do the things that we're doing around voter registration, but more important than that, how do we use that energy? How do we leverage that energy, take that energy and move it to the next level of engaging them, empowering our community to act on those social determinant issues, because that's what leads to health inequity, health inequality rather. And it's up to us and it's to our community to continue to struggle to change those things. Don't underestimate the power that you have to organize and to continue to mobilize our communities.
Absolutely. Thank you, Gonzalo, for that.
This question is for Matt. Oh.
No, go ahead, Andy.
So Jess, I wanted to, Matt, I'm so glad. I remember reading the analysis and being blown away at the numbers. of political science undergrad, so could appreciate the rigor that you put into it, and so cool how amazing it was. Could you, for folks who, we represent, California Primary Care Association represents health centers across the state. The preponderance of the patients who come to community health centers are people of color, but they're not all Latino. How much do you think that there is a Latino link here, or is it more about trust and the community health center? So health centers that don't just serve Latinos, would this 5-touch model also work for them?
I do think that both of those things are going on. The first thing that needs to happen is trust. So it doesn't have to necessarily be another Latino. If you are visiting your community health center and you have a good relationship there, that certainly would work. We've seen that in other studies. But in this case, where you have both doctors and nurses and health providers who are very trusted messengers, and on top of that, they are run from a perspective of the Latino community, you sort of have the best of both worlds, where you have not only trust, but I saw some questions about language access. You're going to have a lot of bilingual professionals here who can talk to these communities in their language of choice. That's really important. And so I think however best you can make a trusting connection with the voter, that's what we found.
Yeah, absolutely. And Matt, if I may, in Santa Ana, we have a large Vietnamese, in Orange County, we have a large Vietnamese population. And in Oakland, we have a large African-American population. And we saw this model work just as strong as we did with the Latino community because of the trusted messenger delivery. I want to talk a little bit about voter turnout. Voter turnout in the March 3rd primary election was about 38%. That was the second highest primary turnout in California that we've seen in a lot of years. It was 4 points higher than the 2016 primary election. What is your opinion on why so few Californians vote, and what can we do collectively to increase this number?
Good. Well, thank you, Jenny. And first, let me start, because between Matt and Castro and everybody else, we've got some smart people in this conversation. So we need to discuss methodology. So that 38% figure that you mentioned is not turnout of registered voters. It was turnout of eligible voters.
Right.
Across the country, as we know, unfortunately, every state's a little bit different in terms of making it easier to register or harder, making it easier to actually vote or harder. California is trying to make it all easier. And so the 38% figure that you mentioned is of eligible voters. So it's a much higher number if you only count registered voters because of how many more voters that we actually have on the rolls now. And it is the second highest in about 40 years. Speaking to your outreach model, let me talk about a model that we're expanding in California known as the Voters' Choice Act, right? A lot of us remember, well, if you wanted to vote, for the most part, it was either vote by mail, which was kind of popular. But if you wanted to vote in person, you were limited to one day, being election day, and one location, the polling place closest to where you live. Well, for working people, that's not the most convenient place to vote because, we got to go to work. Hardly anybody works 9 to 5 anymore. We deal with traffic and commutes and getting kids from school and dinner on the table. And now I got to go stand in line before 8 o'clock. There's got to be a better way. That's exactly what the Voters' Choice Act is. Under the Voters' Choice Act, which is in effect in Los Angeles County, Orange County, Santa Clara County, 15 counties throughout the state, voters automatically get their ballot in the mail, which is what we're doing statewide this November, or they can go to any voting location in the county convenient to them over the course of 11 days, not just one. And so I share that because I think you can appreciate that model, right? In the 15 counties that have adopted the Voters' Choice Act, 13 of them exceeded the record statewide turnout in the primary. So we know that model works from an actual voting standpoint as well. So just imagine if we're able to expand that statewide, coupled with the outreach model that we're talking about here, huge gains in terms of voter participation. And here's the last piece. We can talk about numbers all day long. How many more registered voters, what the percentage turnout was. To me, it's equally important to acknowledge the who behind these gains. because we know who it is that is disproportionately eligible but not registered, or registered but a very infrequent or occasional voter. It is communities of color. It is lower income families. It's a lot of young people. And so the better we do at getting more eligible people registered and more people voting, then all of a sudden the electorate better represents the people. And by extension, who is elected to various offices at the federal, state, and local level, and more importantly, what their policy positions and priorities are. So that's ultimately what this is about. To Castle's point earlier, it's not just a matter of measuring numbers when it comes to our democracy, and it's not just a matter of registration and turnout, but how we translate this into action between elections through community engagement.
Alex, I heard a question yesterday at the town hall that you did with the Pat Brown Institute. I wonder if I bother you to answer this question one more time for the sake of the people who are joining us on this WebEx. The issue is that data demonstrates that the big advantage would be for white populations that would vote more frequently using the mail ballot than would communities of color. What's your sense of what is being done to make sure that communities of colors, and what can we do as community health centers to get people to use the mail system or whatever system would be appropriate?
Right. No, and then in yesterday's discussion, it was a twofold question. Yes, there was this element of who benefits from vote by mail. But also, does it benefit one party over the other? Is this to get more Democrats or more Republicans voting? And my response was, it's not about Democrats or Republicans. It's about voting rights, right? Fundamentally, any eligible citizen should be able to easily register and without any unnecessary obstacles or barriers. That's what we're trying to achieve in California on both sides, the registration side and the voting side. Look, we know that disproportionately who it is that's, like I said, eligible but unregistered or eligible but infrequent voters. And so the reverse is also true. Who is it that is more likely to be registered and vote more often? It's higher income. It is, more in the white communities and older as well. So for them, it's in some areas like Orange County, just shifting how they vote. Do they vote in person, or they're voting by mail more, as opposed to not voting at all? And making the leap to vote by mail. Our experience both in California and in other states is that when you send people their ballot in the mail, right, once they're registered to vote, turnout goes up because, heaven forbid, we made it easier. But there is some important voter education that needs to happen along the way, and that's going to be critical this November. We can have all these convenient, safe options and opportunities we want. If voters aren't aware, they're limited in their benefit. And so, again, going back to the model that you and Jenny especially has championed from an implementation and an advocacy standpoint, we know the model works, and the better we can do to expand on that. You on the outreach mobilization side, us on the elections administration side, that's building a true democracy that I think the rest of the nation will be the envy of.
Thank you.
Thank you. We want to move now to talk a little bit to Andy now. Andy, in close to 55 years ago, the Community Health Center was born out of the social justice movement, which we heard you speak about earlier. And 55 years later, we find ourselves at a critical moment again. Why do you think community health centers, FQHCs in particular, should get involved? And what is Cpca doing to engage and encourage other healthcare organizations to take this on as a mission statement?
Thank you for that question. So we see the linkage immediately between health, social justice, social determinants of health. And I think healthcare providers in large part are challenged by the way that healthcare delivery works, because you're being judged on quality, and yet so much of what impacts our patients is not in the control of the provider, the doctor, the nurse. It is what happens when they leave. I often cite, imagine a woman who lives in a domestic violence situation and she's told to control what she eats and her diabetes, but she might not have control of her paycheck or what happens when she comes home. That's an impossible situation for her, and the provider aiming to help serve her is only paid if she can achieve her diabetes measures, but not help her on the domestic violence issues. So these are the challenges in healthcare, and so immediately you see linkages with the larger community, and it's in the name of community health centers. Community is first, health is second, and we all know that what surrounds us is what influences our health so much. So now it is just pivotal, and I, again, am thankful to AltaMed for creating the model because it came from the community. Again, it's not coming from the top down from the state association, it's coming up from the community saying this is what we believe is right. And so Cpca's role, and I think we've already given them a shout out, but the California Endowment is helping support us in partnering with AltaMed and La Clínica de la Raza and San Isidro and a few other health centers across the state, because our goal is to learn what you have done and then to spread it. And as I like to share this with other health centers, what works with AltaMed, who went this amazing, robust 5-touch model, maybe it's a little bit different in rural California. Maybe they don't have all those resources. How do we learn what you did and tailor it to the specific population, to the resources, so that effectively everyone can have a unique model based in what AltaMed and what's already been studied academically as being, positive and successful. But maybe if that linchpin is trust and health and the linkages there and community, that all health centers can find a way to really take advantage of this program and spread it across the state. And as I noted, health centers today are serving 7 million. When I started back in 2008, I think it was around a little shy of 4 million. So let's say in another 10 years, we're going to be at 10 million. And that could be maybe 7 million, Secretary Padilla. I know we have kids in the mix here, but maybe 7 million new voters showing up to say, I care about my health. I stand here. I stand with my community. And that potential blows my mind. And that's why we're here and so excited about this work.
Yeah, it's absolutely that potential that is so motivating for this work and keeps us going. Because one of the messages that we want to make sure everybody understands is that we all can do one thing. Everybody doesn't have to do the 5-touch model, but we all can do the screensavers. We all can make sure that our doctors have pins about voting. There's always something all of us can do, because collectively what that's gonna look like in November, it's gonna be, dream come true, and I'm gonna be able to retire and live happily ever after. Now I want to talk about low propensity voters, which is very dear to our organization's heart because they look like what our patients look like, also known as infrequent voters, and oftentimes happen to be voters of color. Why is it that these voters, important population, does not receive the same campaign outreach as other efforts? And what can we do to mandate that campaigns work with them and finally achieve voter engagement equity? That's a question for everyone.
I'll jump in first because I think a big piece of systemic correction that's happening is the tremendous impact and success of automatic voter registration, right? So since April of 2018, anybody who's gone to the DMV to apply for or renew their driver's license or their state ID, either in person, online, or by mail, or change their address, has been, if they're eligible, added to the voter rolls unless they choose to opt out. Now, it sounds very bureaucratic and mundane, but let me tell you, more than 2 million new voters on the rolls in California because of that alone, and more than 5 million voters who have had a chance to update their registration, and probably the same number that have confirmed the accuracy of their voter registration. So it's huge for new voters and existing voters, making sure their information is current. Now, why is that critical? Because if you're eligible to vote in California but not registered, to your point, Jenny, chances are, well, for sure, you're not getting the voter information guide. You don't get the sample ballot from your county. And the chances are candidates and campaigns are not reaching you because they're focusing usually on the higher propensity voters, right? They got to convince them to vote for them, for their candidate, or yes or no on this proposition amongst the universe of people that are very likely to vote. So it's sort of a self-fulfilling prophecy. People who are lower propensity get less outreach. And that's the genius behind this initiative. You know, it's amazing how we can drive up turnout, and you've quantified it amongst people who don't vote very often by surely engaging them. And again, through automatic registration, all of a sudden, those newly registered voters are getting the voter information guide, they're getting the sample ballot, and they're going to begin to get the touches from campaigns who know, hey, there's voters out there, they may turn out, and I better get in front of them before they decide how they're going to vote.
I'll just add to that quickly, if I could. One of the things that I think we need campaigns to be thinking about is looking a little bit deeper on the voter roll. Sometimes campaign consultants and campaigns get nervous about that voter who maybe has been registered but hasn't voted in 6 years. And if campaigns can take a harder look at first-time voters and voters that don't necessarily have great vote histories, by engaging them, as the secretary just said, by engaging them, they can come out to vote. And I think that's one of the exciting things about this research is it demonstrates, it validates that they will vote and they can vote at high rates when you engage them.
And then clearly, I would say COVID-19 has taught us a lot. We've learned a great deal about the need for our communities, the need for our elected representatives, our business community, a philanthropic community to become actively and be actively involved in these issues. In the case of Latinos, African Americans, Native Americans, we know that at the very beginning of this pandemic that we were the first, that we knew that we were going to be the first impacted because of all the reasons that we've already talked about, social determinants and health inequities. We knew we were going to be adversely impacted. The truth is that it wasn't until much later that finally there was a recognition in Calexico, in Stanislaus, in other parts of the United States, in Texas, that yes, there are huge communities that are being adversely impacted for all the reasons that you all know. Okay? Now, I would assure you that as soon as that vaccine is developed and it will be made public, if we don't do nothing about this, we are going to be the last to receive that vaccine as well. There's no question in my mind that unless our elected officials, our representatives and our communities, our civic leaders get involved in this issue, we will be the last to receive that. Why? Because we're continuously ignored. And the only way that we're going to get the sort of respect that I think that we need is through the power of the vote. That's what would change. That's how we can demand in any community is by the power of the vote. We'll see huge changes, electing people like Alex to statewide positions, and we have a number that we have elected. They are our representatives, and we can always count on them to be there to speak on our behalf. But we need to elect them not only in California, but in New Mexico, Arizona, Texas, and across the United States, and to have the sort of representation that we need in Washington, D.C. Power is through the vote. And that's what we need to convince our community that that's their way to part of this American dream.
Thank you, Castelo. And for that, I'd like to thank all of our guests and speakers about this important conversation. All of the information that we discussed today can be found at myvotemyhealth.org. Toolkits, screensavers, scripts, everything can be downloaded. All the materials you can be co-branded with your logos, because we really believe that collectively we can get this work done. And while the election is November 3rd, want us to remember that starting October 5th, ballots are going to be in your mailbox. So stay tuned to that and make sure you make a plan. Vote early. Democracy is not automatic. We have to work for it. Vote like your life depends on it, because it does. Special thanks to our community participants in our healthcare centers, and also to our departments in government affairs and community relations, who did an extraordinary job in today's town hall. Now I'd like to hand it over for my social justice partner in crime, Milan de la Rocha.
Thanks so much, everybody, and thank you to Jenny. I want to give another virtual round of applause to Jenny for moderating such a great panel, and to all of our panelists. Thank you so much for your expertise and your openness to having this conversation. We are all really excited to have you here. And thank you all of our attendees and our participants for engaging and submitting your questions. We've captured them all, so if we didn't get a chance to answer them right now, we will follow up with those answers to you as well. And make sure you take down the resources here, and you could always visit altamed.org as well to be connected to further resources. We look forward to next town halls. We look forward to seeing you all again soon. And one last note, we want to hear from you. How did you think about, or what did you, how was your experience, and what are some other topics that you'd like to hear? So be sure to check your emails coming up, post the town hall. We will be sending out a survey to get that information and see how we can develop better and more impactful virtual town halls as we move forward. All right. So one big thank you again from all of us here at AltaMed and all of our panelists. We look forward to seeing you guys all soon.
Thank you, everyone.
Bye-bye.
Have a great day. So many questions.
Well, 1 hour goes by fast.
I know. I'm like, oh, so many questions we have to